recording today's session. If you would like to participate and share without being recorded, either on your screen or with your microphone, go ahead and use that chat box, whatever way you feel most comfortable in participating. And so again, this session is on self-care and supervisory strategies for addressing self-care in vocational staff. We are, for today's session, going to look at a few things. One, we're going to look at the knowledge of and ability to apply self-care strategies, right, for our own wellness as well as our supervisees. We're going to look at components of wellness and concepts of wellness and a specific tool for achieving wellness, which is the WRAP tool, Wellness Recovery Action Plan, right? And we're going to hopefully start developing pieces of our own WRAP, Wellness Recovery Action Plan, for today. So by a show of hands, or if you'd like, a show of hearts in the chat, or even a thumbs up, right? However you want to interact. How many people have heard of the Wellness Recovery Action Plan, WRAP? You can put something in the chat. You can put a heart. You can use one of your, Wanda, I see you have a heart in your icon. I see someone else had a thumbs up. I don't see a name for that person. Oh, Diana, you had a thumbs up. And Jamie, by name only. Okay, so this might be a new tool for everyone on the call today. No worries. This is a fabulous self-care strategy approach that is evidence-based, and we'll learn more about it today. So thinking about the demands on our field and the demands as supervisors, right, practitioners, they have been ever increasing, especially since the pandemic. And, you know, seemingly our taxed, stretched service system has just taken on that much more. So what have we seen in the past couple of years? First and foremost, there has been an increase in social, emotional, psychological, right, behavioral concerns. We see at an alarming rate an increase in mental health conditions, an increase in needs, and an increase in referrals into the public mental health service sector. Does that resonate with folks? Are you observing that? Are you seeing this increase? Sandra, I see you head nodding. Thank you so much. That's something that your agency has observed for sure. Anyone else, feel free to put in the chat, or you can use an icon, you know, thumbs up if your program, Cindy, thank you, great. If your programs have also experienced, right, an increase. I see Wanda, again, thumbs up, thank you, right? So we have a bunch of people on today's call noticing trends are, we are moving in the wrong direction, right? There are increased mental health needs amongst populations of people. Oh, I'm going to make sure whoever's joining us, welcome. Thank you so much for coming. Can you just make sure that you are muted as you are joining the call? Thank you. So thinking about, right, the demands on our field, we know that there's more need. Additionally, because we see an influx of people who are being newly diagnosed, we see an influx of people who need mental health services are being referred at phenomenal rates. That means that there is a greater need for practitioners, for mental health providers. And so there's openings continually for private practitioners, licensed practitioners, public mental health practitioners. There's always seemingly new positions, open positions, vacancies, turnover, which gets into our other demand on our field. With more opportunities and more need, there becomes a ever increasing rate of turnover and retention issues. That has been something cited throughout our collaborators in Washington State as well as folks that we work with in New Jersey, as well as folks that we work with in New York and other states throughout the country. This is an isolated issue. We see that staff turnover is very high, and that retention is seemingly at an all-time low within the public mental health service sector. What does it look like for your agencies? Do you guys see frequent openings, higher rates of turnover? What does that look like for you guys? Put it in the chat. Additionally, as you guys are working through looking at staff turnover in your particular agency, an additional demand is back to in-person services. It was a culture shift to move from in-person to Zoom and telehealth. And we seemingly are now going from telehealth to predominantly in-person. And so this has added another demand, right? We've gotten, and people have gotten acclimated to receiving a good amount of services via telehealth, right? Maybe we didn't have to account for our commutes to get from point A to point B. Maybe we had a reduction in work meetings. Maybe there was a reduction, good or bad, for better or for worse, with interactions with our colleagues and coworkers, right? We didn't have that water cooler talk in telehealth services. And so now we're seeing back to in-person services. While there are so many positive benefits to being in person, there are things that we, for the last couple of years, hadn't accounted for in our day-to-day. Seemingly, the things that we just cited. Yes, Jasmine.
I was going to add to Amy that also the program requirements. So some of the programs during COVID allowed for a lot of like virtual consents and those sort of things. There was a lot of organizations that were shifting their processes to meet that need or that requirement. And then now that back to in-person services are starting to resume, now that shift to scramble and now change those processes for even new hires is also quite a challenge that we've seen.
Jasmine, that's a great point. Yeah, certain laws, certain policies and procedures have changed. Things have been retracted in terms of what we were able to do. And so that has been an adjustment. It's like whiplash, thinking about how things have shifted and how it takes time to get acclimated. It's seeming like another hurdle to jump over. Great point. I'm seeing a lot of things come into the chat. Thank you so much, guys. I'm seeing, yes, Jasmine, very high rates of turnover, so much turnover. Paul, very high turnover. Sandra, yes, turnover, challenges of current staff to meet the needs of people we serve. Everyone is very burnt out. Yes, we're all like super extra burnt out and crispy. We've had high turnover in recent years. Turnover partly due to poor fit between applicant and position, burnout, tension with moving to yes. So these things are ever present, not just in the literature that I'm citing today, but also what we see on the ground, right? From people who are doing direct service and supervising. With all of these demands, it is so very important that we are addressing this component of self-care. Oh, yes, I can. I can hear you. Shakira?
I'm sorry, I didn't mean to unmute.
No worries. I also see from Cindy, the flexibilities associated with COVID are starting to disappear, which makes some folks reevaluate whether or not they're willing to resume a more rigid structure. Yeah, we had significantly shifted our formatting of service provision, and there were many benefits and advantages to that system. Yes, every system has disadvantages, and as did telehealth. But people, reported by and large some positive benefits to providing telehealth services. And so what does that look like? The cat is out of the bag. How do we go back? How does that potentially work? And is it going to disrupt, right, employee satisfaction? Is it going to disrupt, more importantly too, like the satisfaction of people engaged in services? I've in my supervisory sessions, I'm hearing people don't want to go back to just in person. They want their telehealth services. And so how do we accommodate that? What does that look like? So thinking about self-care is so critical. It is really one of the ways that we sustain ourselves in this particular profession. Self-care, ultimately, when you think about it, is within us as practitioners, as supervisors, right? We are ourselves, therapeutic tools. We have a lot of knowledge and awareness. And so this may come quite naturally to us in the provision of service to others. We now have to look at how do we transfer it to ourselves, and how do we transfer it to our supervision, or our direct service care, right? When providing our own self-care as a provider. Additionally, we want to think of, as supervisors, that when people are experiencing stress in regards to their service provision, this is not this is not something that is due to that practitioner's incompetencies or inability or lack of credentialing, qualifications, competencies, so to speak, right? This is something that everyone experiences. It is common, it is normative. We want to normalize this for the people that we supervise, and we want to normalize it for ourselves, right? The stressors of working in counseling services, of working in mental health services, will impact our wellness, and we need to counteract it with good self-care. And self-care needs to be tailored to individuals that we supervise. It needs to be tailored for you, right? We can't have cookie cutter self-care strategies, because what works for me is not going to work for Evelyn. It's not going to work for Shakira or Jasmine, etc. Right? And so we want to have individualized self-care strategies that are ultimately modeled by y'all on this call, right? You set the tone for work culture and self-care. So what do I mean by that? Modeled by the supervisor. If I'm the supervisor and I walk around and I'm bragging, I haven't taken a vacation in 2 years, what is then the work culture expectation? Right? We don't take vacations here. That is frowned upon. If I am taking work home with me and doing work at home and I'm telling everybody this is what I'm doing, what am I modeling? Poor work boundaries, poor work-life boundaries, right? If I'm doing it, then ultimately the silent implied expectation is, well, you'll do it too. That's the work culture here. So self-care starts with us and what we model. Jasmine, also pandemic PTSD is very real. People experience so much loss in various areas. Absolutely. That is a very good point. My doctoral studies is a focus on the treatment of trauma and traumatology. And we have all lived through and are still going through a mass disaster trauma. Disaster traumas are very unique in that typically they're end caps. There's a start and a finish. We don't have that with this pandemic, right? It's seemingly ongoing. And that has been very stressful. So thinking about self-care, it starts with our awareness, right? We need to have good awareness of our practices and ability to self-assess where we are at in our self-care strategies and ultimately where we're at with our wellness. We need to have insight and reflective practices for ourselves and for our supervisees. And people often prefer to have tools that they can utilize to reflect on their own self-care practices and their own wellness. And so I put into the chat a link to a tool that I like to use that helps to bring about your awareness, as well as your supervisee's awareness of their self-care and wellness. This is the Professional Quality of Life Scale, often referred to as ProQual. It's a 30-item self-report measure of the positive and negative aspects of caring in your profession. It looks at things including compassion satisfaction, and then compassion fatigue, which has 2 subscales of burnout and secondary trauma, like Jasmine had noted earlier. The ProQual is one of the most widely used measures to look at the positive and negative aspects of helping in your profession. And it ultimately looks at right? If you're experiencing a high level of burnout or secondary trauma, right, it is implying a lack of that self-care. And so I'm going to put you into breakout groups, and I would like for you to open that link in another window and chat with each other for about 5 minutes about this scale. Just taking a look at some of the questions and looking at the scoring form and getting a sense of what it would be like to complete this for yourself. And more importantly, what it would be like to use this with your supervisees, to helping them start to look at their levels of wellness. Any questions on that task before I put you out in your rooms? No? Okay. I will see you back in about 5 minutes. Make sure you click on that link in the chat before you go into your room to get the pro-qual form and scoring sheet. Again, talk about 5 minutes, and we will be back to discuss. Be prepared to just chat a little bit in a larger group. So we can process a little bit about what was discussed. How did it go? What was the initial thought of the tool, and how might you use that, if at all, for working with individuals that you're supervising? You can put it in the chat. You could.
My group and I, we were talking about how we feel like this is a good way, like kind of like an icebreaker during meetings to even just speak to others or just get a feel of how they feel on the inside. Because of the work that we do, it's easier to ignore how we feel just to help others and put that first.
Yeah, so this, oh, sorry, Shakira, go ahead.
Oh, no, that's great.
Yeah, so it sounds like you might want to use this as a discussionary tool to check in. I love that. Absolutely. Anyone else thinking about the pro-qual? Go ahead, please.
Sure. This is Diane. I use the example. I currently have a staff, a clinician actually, who's out on FMLA for burnout. Essentially, she's getting some self-care, but I also learned that she has a history of this. This is not the first time this has happened to her, but in conversation with her supervisor the other day, just kind of having some conversation with her about, planning for when this person does return and, maybe some things we need to look at in the future. Her first response was, maybe I should reach out and call her. And I said, no, she's on medical leave and needs that medical leave. But now looking at this, I think I am definitely going to give this to my supervisors, open it up for conversation in our supervisor meeting, go over it. I'd love to discuss with them how they can maybe use this with their direct teams that I'm a director, so I have the 3 supervisors working under me, and have them maybe when they start to see those, have those conversations with their teams to be maybe a little more proactive in getting in front of, giving them
Absolutely.
support before they need to take that medical leave, I guess is where I was
Yes. I love that, Diane. Thank you so much for sharing, your perspective and what's been going on in terms of your agency. I hear that a lot in terms, staff needing time for their wellness. It's common. It's unfortunately more common than you think. And so implementing a tool for self-assessment to build that awareness is assistive, giving verbiage to what people are feeling, what they're experiencing, and letting them know that there are supports and resources in place, including supervision, to help think about wellness and self-care before it gets to like the end stages of burnout that you're identifying. I see in the chat, Sandra, you're excited to use the tool. That's great with your team. See what kind of conversations they spark as they're looking at the tool, and using it in a group setting to think about self-care. I love that. Just reviewing the statements on the list makes you think and evaluate your part. And I answer all over the place. Yeah. So that might look different for some people. Where are they at on that spectrum? And getting like a score to reference in terms of, if they're high in burnout, if they're high in compassion satisfaction or vicarious trauma, which again, Jasmine brought up, everyone kind of experienced during this pandemic. from Lunessa, I think this would be helpful to use in a supervision with team members so they can have a conversation if they're experiencing burnout. In a group setting, not sure if team members would be open and honest. And I think we have to look at how would we implement it in a group setting, and forced disclosure of where a person's at may not be the best approach, but giving people an opportunity to think about self-care as a component of the work setting, as a component of what the team processes. I think it's normalizing, right, that restorative function of supervision, and we're going to get into those specific verbiage in a second. Thank you all for taking a look at that and for engaging in that activity. When we think about self-care, having awareness to assess our wellness and ultimately look at our practices of self-care, it's important to notice, and I think we've already kind of established this, what is the cost of neglecting our self-care? And like I said, we've talked about it in many different exchanges and points that were brought up. It is burnout. It is just that experience of being depleted, emotionally depleted, high levels of distress that result in physical and emotional symptoms. And unfortunately, these symptoms do not stay compartmentalized. It's not like, oh, Amy has burnout and she's just feeling it in her work setting. No, when you are at the end stages of burnout, right? There are, I think, five total stages of burnout according to one model. So it's a process. It doesn't happen overnight. And ultimately, when you get to that end stage, it's insidious. All of those symptoms of burnout creep into every aspect of your life outside of work, your relationships. If you're a student, right? If you are married, have children, you're a daughter, a parent, etc., right? That's all going to be impacted by burnout. And again, it's just this psychological and physical exhaustion. And when it sets in, especially at these end stages, it can be really hard to reverse. Taking a bubble bath and a weekend away is not going to negate or mitigate or successfully attenuate, years of neglecting self-care. So thinking about self-care at work, right? Ultimately, we want to engage and have our supervisees engage in activities that maintain and protect physical, emotional, and cognitive health so that they can function in all life domains and in that world of work. Self-care is ultimately, right, at work is the intersection of work and self-care, right? And that is ways that we are practicing what we preach to sustain our work health, our work functioning, to be able to meet our deliverables, to provide good quality mental health services, right? When we are burnt out, when we are experiencing high levels of negative health and wellness, right? A depletion of our wellness, our quality of services take a hit. Our ability to perform our work duties take a hit. There's going to be increased absenteeism. So when we think about, is self-care beneficial for an organization, right? It is for its bottom line. And it is just good practice, right? Adhering to our psych rehab philosophical approaches. So there is this bi-directional relationship, right, with self-care at work and developing our wellness. And for other individuals who may say, like, well, is self-care a part of what we do for supervision? It is. This is the Proctor's model of clinical supervision. It has 3 functions according to this theory. Formative, which is where we provide development of counselor competencies. Normative, which looks at all that managerial supervisory focus, right? Are they getting their case notes done? Is a person completing their goal plans on time? Are they following policy, procedure, protocol? But then there's restorative supervision. And this is supporting our supervisees ultimately in the emotional and physical aspects, how our emotional wellness, our physical wellness can be depleted by the act of being a helper, right? Being in the helping profession. So restorative function of supervision supports your supervisee's emotional processing, reflection, and self-care, right? Restorative supervision should build resilience, should build self-care strategies, and we should be modeling our self-care approach. Ultimately, when we are providing restorative supervision, this is a weapon against burnout. And so if we are neglecting our restorative function as a supervisor, helping people to reflect on their self-care with that awareness that we talked about, building their self-care strategies, we are neglecting a key piece of our supervisory role. So we want to help people take action by building their wellness with self-care approaches, right? When we think about wellness, it's an active process. And it's comprised of making choices that require that self-awareness, making decisions towards a balanced and fulfilling life. We're very good at supporting wellness for the people in mental health services. We need, as supervisors and direct care providers, to apply it to ourselves because we are quite literally working ourselves sick. And then we are unable to focus any time and attention effectively for the people in services if we are burnt out, right? So thinking about your supervisory role, how can you incorporate restorative supervision into your approaches? Here is a sample agenda looking at restorative supervision. This might include either in an individual or team setting, having the person complete the the professional quality of life assessment, the ProQual that we just did, helping a person to look at that on a reoccurring basis. Maybe that's done in supervision quarterly, right? If someone is in particular need, maybe it's done monthly to check in and see where they're at, just to get a baseline and to know, right, what types of supports they might need. Additionally, we can start to incorporate some wellness, small, brief wellness exercises into our supervisory sessions. Modeling these wellness activities, breathing exercises, mindfulness meditation, a body relaxation meditation, right? Any of those thematic skill exercises that help to elicit the relaxation response. Even, you know, some of the folks that I work with, they really appreciate, I think they're called ASMR videos that are very relaxing. A few minutes of this in the beginning of a supervisory session, at the end of a supervisory session, is quite literally like demonstrating like this is meaningful, this is purposeful. I'm going to spend time with you doing this, building this, because it's important that we practice what we are providing to people in mental health services, because we need self-care too. Self-care check-ins can be accompanied with the ProQual or in and of itself, right? Just checking in with level of distress, work stress, feelings of being overwhelmed, things of that nature, just simple self-care check-ins. Additionally, you can include support to reflect on and process feelings related to work challenges, right? An opportunity to be in that process mode, to talk about what has been going on with the people that they're working with processing, you know, things within the office environment, exchanges with colleagues, etc., to support them in those regards. Team building exercises can be a great way to incorporate wellness into the work culture and with the team as a whole. And one of my favorite approaches is WRAP for work, Wellness Recovery Action Plan. This is a wonderful self-care strategy that can ultimately build up our self-care approaches, specifically in the domain of employment, right? It's not just WRAP, it's WRAP for work. And I'm going to put that link into the chat box right now. This link is for the Wellness Recovery Action Plan for Work. As you're opening that up, I'm going to tell you a little bit about this tool. Wellness Recovery Action Plan, frequently referred to as WRAP, is a self-care strategy that is evidence-based. It is empowering and provides a person an organized, structured approach in assessing their wellness. And in this particular tool, their wellness in regards to the world of work. The beauty of this tool is that it can be used by practitioners to maintain their wellness at work, or it can be used in your service provision to help individuals, job seekers, right, with mental health conditions, maintain their wellness at work through self-care strategies. This is a psych rehab tool because it is ultimately strength-based. It's focusing on empowering the person and influencing the trajectory of their own wellness. And it was created by a person who has a mental health condition. If I'm not mistaken, Mary Ellen Copeland was diagnosed with bipolar disorder. And she was tired of being told, you'll feel better when you're on the right medication, or you'll feel better when you're on the right dose or combination of medications. She just was not adhering to this notion that her wellness relied solely on something in a bottle. That yes, her medication did provide support for her wellness, but that there could be things out there that she could do to influence her own wellness. And so that was the foundational motivation for the development of this tool. And so it looks at strengths, inner resources, a person's abilities, right, to influence through self-care practice their own wellness. So who uses WRAP? So many people, so many different populations of people. It's been, again, it's evidence-based, it's studied, it's shown to increase a person's perceived quality of life, to reduce symptomology, to increase wellness, right, by that utilization of self-care strategies. And so we see that it's worked quite well, successfully for individuals with mental health conditions, individuals with physical health conditions, individuals with substance use, or substance use disorder, looking at, a whole host of individuals, including, as you can see here, individuals employed and experiencing burnout. And so the WRAP for work starts with your wellness toolbox, looking at who you are at work when you're well, and what are the things that you do to keep yourself well at work. That is huge. So when I am well at work, I'm coming up, I'm showing up, I'm present, I am early, I am ready, I'm coming prepared. I am eager to take on my day. I'm engaging with people, I'm talkative. When I'm not feeling well at work, I'm calling out. Or maybe I am coming in late. And maybe I'm coming to meetings and I'm not prepared. And maybe I'm not enthusiastic and I'm not talkative, right? When I'm not well at work, I look like a very different person. And so this tool helps me to outline what those things look like, and more importantly, what I can do through self-care strategies to help keep myself well at work. So again, the first part of the tool is looking at Wellness Toolbox, and specifically in the environment or domain of work. So to get you better acclimated to this tool, obviously we cannot go through the entire tool in the next 15 minutes, but I do want to put you in breakout group rooms. And I'd like for you to open that tool and work on the very first, I think it's on one of the first or second pages, looking at specifically when I'm feeling good and performing well at work. Section 1, Wellness Toolkit, and that's on page 7. So I'd like for you guys for the next 12 minutes to look at that page, Wellness Toolkit, page 7, and start just chatting about what that looks like for you and whether or not this could be something you could provide to your supervisees to build their work self-care strategies. Any questions before we go into our breakout group rooms on what we're going to follow up on? Make sure you download or open up that page before we head back to our breakout group rooms. And I will see you folks in about 12 minutes. You just came back from your breakout group rooms where you talked a bit about WRAP for work, the Wellness Recovery Action Plan for Work. What was it like? What did you think about the tool? Especially on page 7, the daily plan that is the precursor to that wellness toolbox. What did we think? Please let me know your thoughts and what you shared.
I feel like it leaves no room for closed-ended answers. Like there's like no closed-ended questions in there. Like they're all open. So
Right.
It's a bigger discussion.
Yeah, there's no yes or no questions. That's a great observation, Shakira. Thank you so much for sharing that. That's intentional. The design of the tool was kind of made to be open-ended, to generate, discussion and feedback. Evelyn.
It could definitely have headed off some issues that I faced down the road with a team that I thought was getting along really well. There are definitely questions in here that would help get a sense of things. There are things that need to be addressed. Yeah,
This might be a good tool to use with supervisees independently, or there could be benefit to having a group discussion. And WRAP is kind of, it was devised to be a group discussion tool. It can be utilized one-on-one, but it can be done in a group setting. In fact, again, that's how the founder kind of initially conceptualized how to use this, because there's support when, oops, sorry. Okay, Google, stop. That's my timer. There's support in meeting with peers and talking about, the experience, the shared experience of being practitioners at a certain program, organization, etc. Thank you. Thank you.
I think we learned the most that we're great caregivers of everyone else except ourselves.
Yeah, Jeannie, that is, I think, so reflective and really digging into that piece of self-awareness, right? There was a lot of, like, I'm sure contemplative discussion going on there, and identifying we are pouring out to others and filling their cup and making sure that they're achieving their wellness goals. But how is that self-care, the time and attention being given to ourselves for wellness management?
We end up taking on additional tasks when we should be showing them that we can do that self-care ourselves.
Yeah, sometimes self-care is saying no.
Mm-hmm.
Absolutely. And again, we have to model that for our staff to set up that cultural expectation that it's okay to say no. Anyone else care to share what kind of was reviewed in your private groups? What was discussed in terms of the tool?
Lisa and I talked about how, for me, it's hard to take care of myself at work, because if I don't finish up everything that I should get done in the day, by the time I get home, then I will be resignating on that at home. So for me, I don't take good care of myself at work so that I can at home, because I'm pretty good at separating work and home. So I really need to improve on that.
That work-life balance is like non-existent at times. And so how can you develop that work-life balance? How can you model it? That's a good, again, it starts with self-awareness. That's a good self-assessment. So we are at time. quick summary from today, we reviewed, what self-care looks like for practitioners, what self-care should look like as a component of restorative supervision. We looked at how neglecting self-care can lead to burnout and poor quality services within our program modalities. A burnt out practitioner does not provide good quality services. We talked about how retention and turnover retention decreases and turnover increases with lack of self-care. And so ways to include restorative supervision, we reviewed that sample agenda, and we talked about an evidence-based tool that you can use for your supervision, as well as for your own self-care practices at work, wellness recovery action plan for work specifically. Thank you so much for attending today's session. You will receive the recording as well as the PowerPoint slides. Please make sure you download the ProQual and the wrap tool from our chat. That will also get mailed out, but I want you to have those things so you can go back to your teams today, tomorrow, and start implementing as soon as possible. Thank you so much, and I look forward to our future sessions on similar topics. Have a great week, everyone.
Thank you, Amy. That was a good training.
Thank you. Thank you for attending. You guys are
Thank you.
fabulous.
Thank you so much.
Thank you.